Hi friends, I am Shom Bera, Senior Consultant Optometrist from India. Today I would like to share with you a new eye disorder and the name is glaucoma. Glaucoma is caused by a number of different eye diseases or disorder that in most cases it produces increased pressure within the eye. Untreated glaucoma can lead to total blindness due to damage of optic nerve head, and the loss is irreversible. It can happen to anybody in spite of any age or sex. If there is any history of family history of glaucoma, then we have to take care it very cautiously. Though early detection, diagnosis, treatment and management can preserve. Say for example, the overhead tank which resembles to our eye, there is an inlet and outlet. In overhead tank, the water flows from the tank through pipe to drain it. If there is any block in the root, then the water will be overflow from the tank to outside. But in eyes, no such system is there, and the fluid remain inside in the eye, which increases the intraocular pressure and IOP that can damage our optic nerve head. Now friends, I am going to show you a diagram to simplify this the procedure that how this glaucoma and the pressure is increased in our eye. The fluid which create or increase our pressure named aqueous humor. The aqueous humor is constantly circulating through the anterior chamber. It is produced by the teeny gland, the ciliary body, that is situated behind the iris. It flows between the iris and lens, and after nourishing the cornea and lens, flows out through a very teeny spongy tissue called trabecular mesoid, which is only 1/5 of an inch wide and serve as the drain of the eye. The trabecular mesoid is situated in the angle where the iris and cornea meet. We call it angle of anterior chamber. The trabecular mesoid, when this drain become clogged, then aqueous cannot leave the eye as quickly as it is produced. Then it causing the fluid to back. But because the eye is a closed compartment, it causes increased pressure to build up within the eye. We call this open angle or wide angle glaucoma. To understand how this increased pressure affect the eye, think of your eye as a balloon. When too much air is blown into the balloon, the pressure builds, causing it to pop. But the eye is too strong to pop. Instead, it gives at the weakest point, which is the side from sclera, which is the side of sclera at which the optic nerve lives the eye. As we mentioned earlier, the optic nerve is a part of the eye that carries visual information to the brain through optic tract. It is made up of over 1 million nerve cells, and while each cell is several inches long, it is extremely thin, about 1/20 thousandths of an inch in a diameter. When the pressure in the eye builds, the nerve cells become compressed, causing them to become damaged and to eventually die. The death of these cells results in permanent visual loss. Early diagnosis and treatment of glaucoma can help prevent from this happening. Now, who is at risk? You, me, anybody. Everybody should be concerned about glaucoma and its effects. It is important for each of us from infant to senior citizen to have our eye checked regularly, because early detection and treatment of glaucoma are the only way to prevent vision impairment or blindness. There are a few conditions related to this disease which tends to put some greater risk. People over the age of 45, while glaucoma can develop in younger patients also, it occurs more frequently as we get older. Second, people who have a family history of glaucoma. Glaucoma appears to run in families in genetically. The tendency of developing glaucoma may be inherited. However, just because someone in your family has glaucoma doesn't mean that you will necessarily develop the disease, but you must go and check for this. People with abnormally high intraocular pressure, means IOP. High IOP is most important risk factor for glaucoma. People who have also diabetes, myopia, means nearsightedness, regular long-term steroid or corticosteroid use, a previous eye injury like blood. How the glaucoma is diagnosed? Your eye specialist has a variety of diagnostic tools that aid in determining whether or not you have glaucoma. Even before you have any symptoms, let us explain some parts where from this glaucoma is diagnosed. Diagnosing glaucoma. Your eye specialist have a variety of tools that aid in determining whether or not you have glaucoma, even before you have any symptoms. Actually, this is a symptomless disorder and we call it silent killer of the eye. Let us explore these tools. First, the tonometer. The tonometer is an instrument which measures your eye pressure. Most important is visual field test. Testing your visual field lets your eye specialist know if and how your field of vision has been affected by glaucoma. The visual field is an important measure of the extent of damage to your optic nerve from increased IOP. There are several methods of examination available in your eye specialist. And now the most important one is ophthalmoscopy. Using an instrument called an ophthalmoscope, your eye specialist can look directly through the pupil at the optic nerve head. Its color appearance can indicate whether or not damage of glaucoma is present and how extensive it is. Now the last part, is there a treatment? Definitely there is a treatment from glaucoma. Glaucoma can be treated with eye drops, pills, laser surgery, glaucoma operation also is there, or a combination of methods. The whole process of treatment is to prevent further loss of vision or visual field. This is an imperative or irreversible loss of vision. Glaucoma is irreversible. You have to understand it. Okay? Keeping the IOP under control or below the level where the glaucoma is found is the key of preventing loss of vision from glaucoma. Your doctor has several opinions for doing so. They include. So friends, stay safe, stay healthy. Namaste.